Good afternoon, Durham. I'm Jenkins, Director of the Durham County Department of Public Health. As COVID-19 continues in our community, new test sites are being opened throughout the county, and we continue to encourage you to get tested as needed in order to keep yourselves and others safe. But it is important to know what to do after you are tested for COVID-19. So today I will explain what should be your next steps, whether you test positive or negative. First, what happens if you test negative? If you've not been in close contact with anyone with COVID-19 and you are not feeling any symptoms, you may return to regular activities after testing negative. Just be sure to continue practice social distancing and wearing a cloth face covering. But if you've been in close contact with someone with COVID, it is important to stay home for at least 14 days after the date you were exposed to this person, even if you test negative. It can take up to 14 days after being exposed to the virus before it presents itself and infects you. So this is why it's important to stay home, even if you test negative at first. In other words, you can test negative a few days after exposure and still become ill up to 14 days later. Staying home helps limit the chance you will pass the virus to others. If you do not start to feel sick during these 14 days, you may return to regular activities. But if you start to feel sick during this time, contact your doctor or the health department or consider getting tested again. This brings me to what you should do if you test positive. First, and most importantly, stay home and away from others. While you're at home, try your best to stay away from other members of your household. And after you test positive, you will receive a phone call from the health department team member, and they will ask you a few questions and give you guidance for staying safe. This is part of a process called contact tracing, and answering this call is critical to stopping the spread of COVID in the community. Please answer the call. While you're at home, monitor your symptoms. If your symptoms get worse while you're at home, contact your medical provider or the health department if you do not have a medical provider. Stay home and monitor your symptoms for at least 10 days. You may leave isolation after it has been 10 days since you began feeling sick, and you've been fever-free for at least 24 hours without fever-reducing medicine, and your symptoms are improving. If you tested positive but have never had symptoms, stay home for at least 10 days from the date you tested positive. After you meet these guidelines for leaving isolation, you may leave home again, and it is not necessary to return to be tested again before returning to work. This is not a recommended action by the CDC or the state. We know this may be a lot to remember, so be sure to check our website or call the hotline if you have questions. And we also know this guidance may be different from what you heard weeks ago, but remember that this is a novel or new coronavirus, and sometimes information from the CDC may change as we learn more about this virus and its risks. So please, be sure to tune in to accurate information and follow accurate guidance. By working together to follow this guidance and protect ourselves and one another, we will stop the spread of COVID-19 in our community. We can do this, Durham.